All right. Good afternoon, everybody, and thank you for joining us to our webinar, Worksite Plan webinar. Before the speakers get started, wanted to go over a couple of homekeeping items. So at the bottom of the Zoom webinar, you will have a toolbar. We do have the chat enabled, but we would highly encourage everyone to go ahead and use the Q&A icon. Go ahead and click on it, type in your question, and we will try and answer them throughout the meeting, but we will hold live answering of the Q&A till the very end. And again, to introduce myself, my name is Carmen Valadares. I am the Registration Manager and Event Coordinator with Conference and Event Services. I will be your host and your producer in the Zoom world. That's the term. And then my co-host will be Brianda Norcutt. She is the Director of Communications with FOA. And my other co-host will be Henry Texiera. He is Instructional Design and Multimedia with FOA Communications as well. So we're going to go ahead and get started. So what is it today? Today we're going to go over creating and implementing worksite plans. The topics are going to be covered will be what is a worksite plan, the who, what, where, and why, guidance for physical distancing, hygiene, disinfecting, and use of symptom surveys, scheduling employees and supporting remote work, reviewing example plans, and communicating your plan and training employees. And now to our presenters. First presenter, well, not in any particular order, they will be speaking throughout the presentation. We will have Gabriella Renteria. She is the Risk Manager at Risk Management Services. Finis Jones, Director of Custodial Services. Jim Carroll, Associate Vice Chancellor, Design and Construction Management. And Sandy Batchelor, WorkLife Manager at Human Resources. So we'll go ahead and have our first speaker queue up. That would be Gabby.
Good afternoon, everybody. Gabriella Renteria, Gabby, to most of you. Welcome. A little hard not to see everybody, so we'll just jump right in. Worksite plans. What are they? What do I include, and how are they submitted? Carmen, go ahead and jump to the next slide. So every work site or every unit is what I usually describe it, is required to create a plan that meets the requirements, the safety requirements. Basically, it's you can think of it, it's a COVID-19 prevention plan. So every unit is responsible to describe how are you gonna go about and prevent COVID-19. So your plan is going to touch on preparing the physical space. You're going to touch on preparing your workforce. How are you going to control access if that's applicable to you? How are you creating a social distance, or probably we should call it physical distancing? How do you reduce those touch points? How do you increase cleaning? And then lastly, how are you going to communicate? That's a big part of this. Everybody needs to understand that the plans are unique to you, unique to your work site, unique to your unit. It begins with a risk assessment. You really have to envision kind of a normal day at your work site, and what it is like for employees to move throughout the day, and where you can build in these prevention items that we'll go over in more detail in the webinar. In a very simple example, I'll use my own team. So we have a team of 4 analysts. They handle risk and workers' comp. And their office it's kind of a medium-sized office. It has 4 cubes, also has a copy machine that's used by many people within our safety services organization. We also have an area where there's a shared mini fridge, microwave, water dispenser. So when we start looking at this, the first thing is, we start as a team discussing what can stay remote. Fortunately, a lot of what we can do remotely. So there's, at this point right now, I don't have a need to bring everybody in, to the normal schedule. So we can perhaps For those that need to come in on occasion, we communicate, we work out a plan as far as, who's coming in the office to try to maintain one person for that office. We perhaps alternate days. We've decided to control access by making sure our door is locked. That doesn't mean our copy machine is off limits to other people in our organization, but we've already created some rules about, for example, knocking before you're coming in. So the person in the office knows they need to put their face covering back on. So we're going to now have more people in the space. We have cleaning supplies stocked near those touch point items and signage saying you have to wipe it before you use it, after you use it. So really, it's very unique to you, and a lot of communication goes into it with your teams, the employees that are reporting back to campus to do work, and also with your leadership. Carmen, you can go to the next slide, please. So who creates and submits the worksite plans? So every college, school, unit, you need to identify an individual that's going to be responsible for this. And it's not a one size fits all. I really do recommend that, you before jumping into drafting a plan, that you work with your teams or leadership to discuss the best way to go about doing it. It really needs to be a team approach. For example, safety services, we're an organization, we have 5 units. The leaders of those 5 units, all met remotely to discuss, what are items that we have in common that we share, and what are things that are specific to us that we need to create on our own. Sometimes it's driven by location. We have people that are in different sites on campus. Also, it may be driven by function. For example, occupational health, which is part of safety services, is a very different function than perhaps our lab inspectors, for example. So, again, before just jumping in, it's really good to kind of devise a plan as to who's going to be responsible for it, and before you get too far into it, and kind of share and discuss those ideas. Okay, next. So submitting a worksite plan. Every plan needs to be, once it's completed, drafted, it needs to be submitted to your dean or vice chancellor, vice provost, or equivalent executive. They need to approve the plan first. Once that's been approved, you can email the plan to campusready@ucdavis.edu. Go ahead, you can go move to the next slide, Carmen. So once it's received to that email address, then the vice chancellor, FO, and risk management will review the plan. It's going to be kept on file. We're basically reviewing it for any improvement recommendations. Flexibility is a key here. Guidance from state and county changes quickly. So sometimes what we're looking for is whether or not there's been a change that has not yet been communicated or reflected in the plan, and we may need to update. So I think it is, this process is new for everybody. So we're doing our best. Please be flexible and patient with us. I think it would be helpful if once you submit the plan to the Campus Ready website that you perhaps include a desired go live date, and that will help us prioritize. But again, you can, for all intents and purposes, if you have the approval of your executive, then you can continue implementing or continue implementing your plan. Next. So I was just going to kind of go into why are we doing this? I mean, basically, we're doing this to be prepared as an employer, as a campus. We're doing it to be prepared to receive our workforce, to receive our employees, to receive our students. We're also doing it to make sure the people that are returning to campus that they're prepared. And all this keeping in mind that the transition back to campus to do work on campus is safe and as effective as possible. Next. So this slide and the next slide is going to touch on the guidelines that's described in a document titled Guidelines for Return to Administrative and Office Work in University Facilities. That document you can find on the Campus Ready website. It was last revised on July 16th in response to some new public health mandates. And basically the revision was briefly to be as remote as possible, just for folks to really take a look at the work that they do and whether or not it needs to return to being remote, but really just to have that honest conversation about what can and should continue to be remote. So again, flexibility, you're going to hear that lots, in response to changing conditions is a must. So these two slides again are pulling from that document. You know, it's the highlights are our plans are going to comply with the directives. It's going to ramp up in alignment with, you know, what we need to respond to on campus. We know what work we need to get done on campus. Again, it's encouraging and supporting remote work when possible. It's allowing for reasonable accommodations for employees. Carmen, next slide. It responds to new public health guidance as it becomes available. You know, that's a big one. I mean, in this time of pandemic, I've used the word pivot so many times. I wish I had $1 for every time I've used that word. But you know, it's all anchored in keeping our folks and our campus safe. And sometimes we're gonna have to be ready to change. So that's something you have to keep in the back of your mind at all times. You know, your plan's gonna really, you have to do an individual assessment of the risk in your areas. You need to coordinate, you know, with other programs when necessary. And if applicable, you're also going to reflect the professional guidance. And a good example here is for athletics, the NCAA guidelines that they have to also follow. Next. All right, collaborate with groups sharing your space. You know, you're again back to communication, teamwork, collaboration. An example would be, you know, over here in my building, I'm located in Hoagland Hall. We have some meeting rooms that we share with academic departments. So, you know, we have to communicate with them as far as what are those meeting room rules are going to, you know, what are they going to be? Is it going to be reservation? You know, who's going to be responsible for cleaning? You have to agree on how physical distancing is going to be maintained. So if you are in those areas where you have other units, you need to do your best to reach out and collaborate with them. Next. So the elements of a plan. So the rest of the webinar is gonna, you know, the presenters are gonna touch on these three areas: the physical distancing, hygiene, disinfection, symptom survey protocols, implementation, and employee training. You know, they're going to get into these in more detail. You know, we ask you to just really think about these areas as critically as possible. You know, perhaps it's easier for you to think of it from your employees' perspective. You know, our employees that are returning to campus, you know, if they were to look at this worksite plan, and they will be working at the worksite plan, you know, they want to know what's coming. They want to know, you know, what their worksite place is going to look like when they come back. You know, I mean, by being as descriptive as possible, by communicating as much as possible, this is how we keep our campus feeling safe. I know there's no risk in this time of pandemic, you know, but we're doing our best to help the uncomfortableness of it by communicating as much as possible, spelling it out as much as possible. You know, there should be no surprises. You know, and on that point, you know, how are we going to handle change management? So, and part of that is, you know, if you can create a plan that's as detailed as possible and reviewing it with your teams before they come to campus, that's the thing to do. So you can iron out those questions. Perhaps it'll point you to where you need to make some changes in your plan. Again, think of it from your employee's perspective. That's probably a good way to start drafting your plan. But again, we're going to get into these particular buckets going forward. So next.
And I believe that's it for that section for Gabriella. Thank you so much. And we're moving on to the next section with Jim Carroll. Jim, go ahead.
Gotcha. Thank you. Good afternoon, everybody. I hope you can hear me okay. I'm the Associate Vice Chancellor out at Design and Construction Management, and I've been asked to walk through some of the evaluation points that we've shared when we were looking at our plan, and share maybe some overlaps to assist you with putting together yours. During maybe the next 10 slides, we're going to talk about general concepts of the planning and tools, some resources that are available, some of the analysis that you'll need to go through, and then a little bit of configuration and narrative that you'll need to take into account as you develop your plan. Just as a big picture, this is your plan. So we're going to show you some specific plans later in the presentation, but I want to emphasize this is the plan that you should come up with. It should make sense to you. It can be more pictorial, it can be more narrative, it can be more of a checklist. But keep in mind that this is going to be the plan that you would best use to communicate to your team within the spaces that you're using within your unit. So next slide. Okay, so this is really one of the tools that we're going to share with you. Building layouts are available really to devise the physical distancing portion of your plan. That's going to be one of the most important elements that you look at, is just how many people are you going to be able to get back into your space as you look to ramp up. So this link right here is a facilities link. It's available to most people on campus just with a login, but most of the units do have a space coordinator that can assist. If you are challenged with this too, we have pathways in our space management section of the DCM website, or you can always reach out to us if you have assistance, just need assistance getting into the plans themselves. If you're not great at reading plans, also maybe reach out to some of your team that might be a little better, the space coordinators, or again, you can reach out to us, or you can simply walk through the space and imagine it partially occupied or fully occupied. Many people aren't as good with 2D plans, and you understand the 3D space much better, and that'll assist you in devising the plan that you come up with to do this. Gabby mentioned it, but please keep your neighbors in mind. You know, if you're in a group in a building that has other people around you, it's okay to communicate with them. If you're in a one-story building that's a multi-user, or a two-story building, keep in mind you've got separate suites, a variety of entry points. There's corridors of restrooms where you're going to come across some peers. If you're a single user, you're probably most concerned about things like reception areas. And if you're in a multi-story building, elevators and stairways are going to come into your narrative a bit more. We won't all have those, but if you're in that situation after you look at your plans and speak with your neighbors, I think it might be worth talking it out first before you do your plan. Next slide. So configuring the work sites for physical distancing. Again, this is going back to more of a graphic. So if you're facile with plans and you're comfortable looking at this, we've tried to use a graphic that shows green for go and red for no go. So it's available and unavailable seats. On this particular graphic, and the graphics that you'll see later that we've developed, we are using a 6-foot radius circle. That's going to be a more restrictive circle. We're definitely using that because when you are trying to keep 6 feet away from somebody, it's good to imagine that it's not 3 of yours and 3 of theirs, but 6 of your own. If you want a really good, easy way of doing this, and again, if you're a little bit more challenged with dealing with plans, but you have a tape measure at your house that you use, take that tape measure and sit it on 6 feet and just sort of put it up against yourself and walk around the office. It'll look a little silly, but we are definitely underpopulated in many of our offices now, but it'll give you a really good idea about what that 6-foot dimension does. If you really look at some of the square footages that we use in planning, we have been greatly avoiding putting maximum occupancies in buildings because we really want this 6 feet of physical space. A 6-foot radius is 113 square feet. That's about the size of a typical office, which you might say if you're in an enclosed office, you're one person and you really can't have anybody in there. I think that's a pretty good possibility and a decent rule of thumb to undertake, but it doesn't mean that somebody can't stand at your door, particularly if you have a face covering on. So your circles can overlap, and you see some overlaps in this graphic, but the whole point is where they overlap, we're trying to avoid. A lot of chairs have wheels on them, so you really need to beware of that if you're sitting in a workstation and slide across. Another thing is the differences between offices and full height, which are full height walls with a door, temporary use of meeting rooms, and then partitions. So you have shorter partitions that aren't going to offer you a whole lot of barriers. So again, this drawing is showing you that 6-foot radius, which is a higher measure of safety. Next slide. This is the first of the rooms that we're really going to talk about that are shared, and we'll go back into this later in the presentation when we show you a couple of specific worksite plans. But the big picture with this is, again, the 6-foot radius. You know, a typical meeting room is set up and designed for 30 square feet per person. And if we go back to that 113 square feet just in the circle, you know, your largest meeting rooms that normally hold 25 to 30 are probably going to hold only 5 to 8 people. You can look at this drawing here and you can see a whole lot of red, and you used to be able to hold about 15. You're only getting 3 in there. So the chairs can move. You still need to keep 6 feet apart. You know, keep your tape measure against your waist as you're modeling this, and you can definitely rely on a lot of signage. There's great signage on the Campus Ready website to share with your teams how many people you expect in there or the distance that you expect. So posting room rules and protocols will be particularly important for public spaces. Next slide, please. Restrooms. This is a challenging one too, but again, restrooms are support spaces. They don't typically come with a square foot per person when you lay a building out. They're based upon how many people you actually get in the building. So the good news is if we have about half the team and we use about half the bathrooms, you shouldn't have a very stressful situation per se with respect to the meeting the 6-foot distance. In restrooms, you might want to put some tape on the floor. You might want to put a sign in there if it's real small that says, "Hey, do one person at a time." You want to touch as few items as you can. Some of us have touchless bathrooms, but in most of the buildings on campus, we don't. So that tape on the floor and signage will be very important to us. Okay, so much like the restrooms, break rooms, kitchens, these are support spaces. So again, try to be 6 feet apart, maintain that dimension. Tape on the floor is a good idea. You'll see this, the visual indication around sinks, refrigerators, copy machines, tables, those type of things. It's good to put some tape on the floor. I think if you can get into the room and move around by keeping your 6 feet separation, you can use the microwave at the same time somebody else is using the sink, but be cognizant not to overlap. And as your break rooms get a little bit smaller, again, rely on signage. It's okay to put a sign up that says one at a time. I mean, we can all work together on this. And an important element on this one is keep cleaning supplies nearby. Unlike the restrooms that have occasional wipe downs, the break rooms are used all day. And as they're used, it's good to have cleaning supplies nearby. This is also another good opportunity to say that you should be wearing face coverings when you're away from your desk. So make sure you're doing that as well. Okay, next slide. Reception areas. Now this is going to vary greatly depending upon whether you have kind of a front door, front room, if you seat somebody at the front, or if you're really just part of a larger suite. So visual indication of the 6-foot distance will be important. We do have some plastic panels up at certain locations around campus. We want to designate clearly where we have guest queuing areas and guest waiting areas. So if you do think within your plan you will have some meetings that take place, you'll want to make sure that people queue up with distance, and specifically they come through the reception area with 6-foot distancing. Further, a bit of sanitation station that's immediately past the reception area would be great. And then, of course, establishing your protocols should include people that are expected to be there and maybe greeted by the person that's hosting them or unexpected guests. You also would like to use that person, I would say, if you have a receptionist, you'd probably want to use that person sitting there to reinforce the requirements to wear face coverings and maintain distance indoors. Next slide. So movement of people, again, corridors are for everyone, but often at the same time, people are using these spaces. So one-way directions are going to be pretty important to show. We will share some of those with you in the later slides. Try to avoid looking down at your phone when you're walking in these public spaces. We all do that, but keep your eyes ahead and kind of keep your head on a swivel. Taping the floor would be a good idea, again, just to show direction, and signage in this case will be very important. Next slide. Further, as you're looking at movement throughout, a couple things to keep in mind, and these next two slides will address this. So you don't really want to place furnishings in the way of exits. So I know what's going to happen is you get your meeting rooms, you're going to stack your chairs up, and you're looking for places to stack the chairs. So be cognizant of the fact that since you're going to be underpopulated in the meeting rooms, you might want to keep the stacked chairs in the meeting rooms. It's a much better way to do that than putting them out in the space and having them inadvertently get in the way, particularly chairs with wheels, inadvertently getting in the way of blocking an exit. So we'll have to rely heavily on signage again here. Okay, next slide. The last one in this section is related to ADA compliance. So this is a similar thing with chairs, and then a reminder as well. So keeping the chairs open and away from access ways will support ADA accessibility within the space. And then beyond that, fire safety. One reminder is, none of this distancing or any of this stuff applies in the event of an emergency. Exiting the building is the most important issue. So you can be reasonable as you exit, but try your best in the event of an emergency to simply get yourself out of the building and not worry as much about the distancing. You have to maintain accessible routes to the public spaces like restrooms and break rooms for ADA compliance, and again, signage will help you here. Okay, next slide. Okay, so this is the last one for me in this section. So just a little bit of a reminder of things to include in your work plan. Physical distancing is only a part of the solution. So you're seeing, unique spaces are what you want to focus on in your plans, workstations, enclosed rooms, restrooms, break rooms, all those pieces and parts. But also you want to put reminders up with signage to consistently use the face coverings indoors, wash your hands, avoid touching your face, stay home when you're ill, all the basic rules of thumb that we've been seeing. Use your 6-foot radius, try the tape measure the first time in your space if you're not comfortable with reading plans. Certainly be cognizant of overlaps with coworkers. Try not to sit in anybody else's circle if you can sort of visualize that, and use a lot of the signage offered by FOA.
Thank you so much, Jim. So now moving on to Finis. Finis, are you there?
I'm here. Can everybody hear me okay?
It's all yours.
All right. Well, again, my name is Finis Jones. I'm Director of Custodial Services here, and talk a little bit about, hand hygiene and disinfection and what you can really expect from custodial services when you return back to campus. Next slide, please. So our focus on the campus will be high traffic, high touch areas. And so when we talk about high traffic areas, for the most part, we're referring to just occupied spaces, places that, will have folks occupying them on a more regular basis, accustomed to like how we used to operate. And then when we're talking about high touch areas, we're really talking about entrances, lobbies, light switches, stairwells, elevators, and the buttons, restrooms, and classroom spaces, and any study spaces. So that will be our primary focus. And we'll be shifting some of that responsibility that we used to have as far as like offices and laboratory spaces really onto the building occupants themselves. And I'll talk a little bit more about that as we go through my portion of the presentation. But a critical portion of us providing adequate resources or custodial services to each one of these spaces is really going to be communication of what your guys' anticipated occupancy is, what your anticipated schedule will be, because like most people on campus, we've been impacted greatly as far as like our staffing. We do have adequate resources, but unfortunately we do not have unlimited resources. So if you could give us a schedule communicated to our UC Davis email of what your guys' anticipated schedule will be, that will allow us to appropriately plan for your arrival and be able to provide adequate spaces, adequate custodial services rather. We do have established protocols for COVID cleaning with APA approved disinfectants. And we've been actively training our staff on how to disinfect high touch point areas. Those protocols, if you're interested, are available on our campus website. Next slide, please. As far as creating a work plan, it's important for each person to identify common or high touch areas. So your door handles, your light switches, your desk, arms on the chairs. Those are always going to be, a heightened focus for any type of disinfecting that you're doing in your own workspace. I would definitely try to, make supplies available for your staff. Aggie Buy is a great resource for finding supplies if needed, but try to limit the amount of times that you guys have to share cubicles or share spaces. I know over here at Custodial Services, we do have folks that share offices, but we try to stagger them and then try to implement a process for wiping down after each time you use that space, before and after. It just helps with good hygiene and limiting the spread of germs. Again, making supplies available for your employees and guests. Custodial Services will be taking on the burden of trying to supply hand sanitizer across the campus. It will start off in main entrances. So if you walk into a building, you should hopefully see a hand sanitizer stand, hopefully starting next week. If you need more than that, again, use Aggie Buy as your resource. Next slide, please. Again, individual, responsibility is going to be the biggest key here in ensuring everybody's safety. We would encourage you from a custodial perspective to remove any unnecessary items like from your desk. It makes it a lot easier to clean those spaces, whether it be, clutter from paper or small trinkets that, help brighten all of our day. Sometimes those things oftentimes get in our way as far as like trying to do disinfecting. So that would be a recommendation from us. We would also, again, make a habit of wiping down your space before and after. Making those items available to your teams is crucial, putting them in one spot so that folks know where to go find them. And if at all possible, supplying each and every single one of the employees with the supplies that they need as far as disinfectants and paper towels and things of that nature. And then signs are great, but also, gentle reminders as far as, good hand washing and hand hygiene, using the facial coverings, and then also, physical distancing. Not having too many folks occupy your workspace is a great way of, changing our culture as we deal with this new normal. Next slide, please. And again, just want to reiterate that Aggie Buy is a great resource for procuring these supplies that you may need, whether it be hand sanitizer or paper towels or disinfectants. If you're out there on your own trying to find those things, I'm sure you found, struggles. Even in our own department, we have those struggles, but supply chain has really done a great job of bringing all those items together for us and being a great resource for us. If you have any issues with finding things in a pinch, Custodial Services can be available to supply you with disinfectant and bottles and paper towels if needed, but we would definitely encourage you to go to Aggie Buy first. And I believe that's all that I have.
Yes, thank you so much, Finis, for that. And we're going to have Gabby go over the next section.
Yeah, and this one's, I'm looking at some of the questions in the chat, so this is definitely a hot topic and something that's been changing quickly. So just a little bit of background. It was always a recommendation that some level of symptom screening was done. And the way we were kind of band-aiding this, because we have had people working on campus, we have custodial, we have some animal care, there's things that still have, that were deemed essential and have been ongoing. And so to Band-Aid that, our recommendation for a little bit now had been to use the CDC self-checker, and it's to ask the employees or people that are reporting to work to go through the self-checker as a means of determining whether or not they have COVID-related symptoms before arriving to the work site. What is happening, what's in process now is that we've gone through a couple of versions, a pilot version of a UCD symptom survey. I think we're at the final, I think we can see the finish line is what I'm trying to say. So it should hopefully go live on August 17th. I know right now, Eric Cavigny, AVC Safety Services, is leading that particular project. And there's a lot of communication being built right now to support the symptom survey, web resources, et cetera, as far as how to use it, as far as how to implement it. There is a public health campus policy that has been circulating for approval, and in that it really does mandate the symptom survey, and it matches system-wide what the recommendations have been. So you can expect the symptom survey is mandatory. You can go to the next slide, I think, Carmen. Okay, so maybe we just have one slide on symptom survey. So again, more coming on that topic. It is mandatory. I think what you're going to have to start thinking about is how you incorporate it into your particular plan. And what I mean by that, we're going to build more resources on that topic. But for example, we have some locations where they have a very controlled access point, and they have an employee that may take the symptom survey on their phone. They get the green light, and they show that upon entering into the work site. Not for those of you that are familiar with what health was doing, it's very similar to what the health side had been doing. There are other units that are more of an office-based and unit where on occasion someone comes in and perhaps they don't have a controlled access point. You can come in many ways, and that is just going to be more of a compliance check. There is reporting being built around this where that's going to be the second phase of the symptom survey, is the reporting part. But the idea is that you can check on a weekly basis to see who's been doing it. For example, if I, just say pretend Eric Vigny reports to me, I know he's been on campus every day this week, and I go and I look and I tell him he hasn't done the survey once this week. That's gonna, there's gonna be a conversation because it is a requirement. So there's gonna be different ways of implementing the symptom survey, and so there's more to come on that. And then to touch on the rest of the slide, these bullets should be included in your worksite plan, and this is what Finis just went over. You need to describe your cleaning supplies, where are they gonna be located, how will they be supplied. You need to describe your protocols for disinfecting, shared spaces or, between users. You need to describe the responsibilities that everybody's going to have in regards to cleaning and hygiene, etc.
Thank you so much again, Gabriella. And now we're moving on to hear from Sandy Batchelor. Sandy, are you there?
Yes, I am. Thank you.
All right.
So I'm going to give the WorkLife Human Resources aspect of our returning to campus. So we're looking at ways to help achieve what we've been talking about thus far, basically reducing the number of overall people in a space together. So let's look at how we can do that with scheduling. Next slide. So deciding who should return to campus. So prioritizing remote work when possible to minimize the number of people at the work site. Think critically now about who and what tasks need to return to campus first. And we have a useful planning tool, a PDF there, which identifies considerations for the different roles, teams, and individuals. Things like where the work role is best accomplished, which team members should be provided more access to the office, to others, or to each other. And then considerations for individuals. So looking at your individual employees and what their needs and circumstances are. So be sure that you have a conversation with each employee to learn their readiness, their comfort levels, their life circumstances. Be careful not to assume things based on what your employees' status is or their work life circumstances. So be sure to have a conversation looking at each person's needs. Also factor in individual performance and individual strengths. So based on the role, right, what are the needs of the role, the student, the program, the research, and the client needs, as well as meeting the business and service requirements balanced with the physical layout needs. And the phases, planning phases on factors identified and prioritized in the planning process. Next slide. So strategies for employee scheduling. We basically look at the two factors in flex work. So if we look at flexible work, we have flex in time and flex in place. So remote work is flex in place. We're all very familiar with that right now. Flex time has two elements. One is the compressed work week, which condenses one or more standard work weeks into fewer, longer days. So basically, somebody may be working 10 hours a day, 4 days a week, instead of 5 days of 8 hours. Flex hours alters the start or end time of your workday. So you're still working, your employee's still working the same number of hours, but those hours are just flexed. So you can combine flex place and flex time to find solutions. So shown here, it's utilized as staggered shifts and alternate office days. These are both used to reduce the number of people at the work site. So in combination with working from home and staggering shifts and alternate work days, using both flex time and flex place, you can find a way to reduce the number of people in the office at the same time. Spend some time thinking about how you can utilize these strategies to further minimize the number of people who are simultaneously there. So sort of thinking outside the box on how you can get people in the office, but not all at the same time. Next slide. Scheduling employees. So in the worksite plan, how to apply this information to your plan. Describe how flex place and flex time will be utilized to describe how to find balance between the physical layout and the business needs. Next slide. Communicating the plan and training employees. So this is ensuring your employees are aware of the new guidelines and protocols. Next slide. So after communications with each employee and making a plan, then have a meeting to discuss and review the plan, touching on layouts, the physical distancing, the new protocols and responsibilities, new schedules, new situations that are unique to your work site, and establish some expectations around these factors, making sure that the plan is available to all staff. So sharing your work site plan so that everyone has access and is all on the same page. Next slide. How to put this into your worksite plan. So simply describe how you communicated your plan and how people will continue to be informed and trained on these new protocols and the expectations of these new protocols. How will you make sure that these are going to be communicated?
Thank you so much for that. And we're going to move on to the next section with Jim again. Jim, whenever you're ready.
Okay, absolutely. Thank you. So we're going to share with you a couple of example plans. You know, each of these work sites is unique. These two plans that we're going to share with you are completely different formats. We had sort of hinted at that before, but you'll see how different they can look. So next slide, please. Okay, so the first one we're going to go through is the DCM plan. So a couple of things. We are designers, architects and engineers and planners over at DCM. So we communicate in plan. You do not have to do that. As we mentioned before, you can do it in a different way. And a second plan we're going to show you right after this shows you a very different way of doing it that's just as effective. We used a Lean Six Sigma A3. A3 is nothing but a paper size, but it's an 11 by 17 size. And what it does for us is it allows us to print these out. We can put them all over the place. I've been sending the PDFs out to my team, so it's an easy way for us to communicate. So the reason we had to go for this approach is that construction is considered an essential activity by Yolo County. So many DCM employees have been on campus during the entire pandemic. We're a large organization. We're in one building. We're out at 255 Cousteau, so we're off campus. Then the primary reason we were doing this and tried to jump in it early, we did this several months ago, was as a guide for assisting the campus in doing this. So we put this up as an example of a graphic version of this. So my team collaborated to develop this plan. As I said, we're designers, so we communicate in plan. We used a simple approach like the A3. We had a plan layout that I did ask one of my team members to develop. Chris is an architect, and he did a first layout for us. And then we came up with several different options after that. So what the concept was, and you can kind of see this in plan, we're drawing these 6-foot radius circles. The rectangles that you see of varying colors, and there's a little legend down there too, are intended to be the days that you're on and the days that you're off. So we were on a flex place concept, not necessarily a flex time concept. So we just continued to overlay schedule options for backfilling until we got to a point, and you'll see in the week 1 and week 2 down below there, the blue group adds up to 50 people and the purple is 42. We were trying to get it to kind of a 50-50 backfill. And then we used at that time guidance from CDC and the World Health, and of course UC Davis narratives to develop some bullet points. So I'm going to go through a couple of highlights of the plan specifically. This is the overview side of the building. It shows our entire building. We also share a narrative on what the department should do versus what the occupant should do. And you'll see this in different ways in our next example as well. But the effort for that is just, and I'll point out one or two, this is kind of trying to telling the people that are running the organization, reintroduce the staff into the office on staggered days. That's one of the bullets up top. Establish directional pathways, provide signage or floor markings. This is the type of stuff we talked about earlier in the presentation. What the occupant should do is a bit different. You know, the occupant needs to consistently maintain the 6 feet, clean your space, bring your own water bottle and mug to avoid reusing the break room very often. You know, avoid sharing supplies, those type of things, and mainly continue using your teleconferencing rather than meeting rooms. So really, that was the important overview that we wanted to offer to provide kind of a larger look. We show primary and secondary circulation patterns, and we break out the narratives for the important shared spaces. So if you go to the next slide, you'll see this is the opposite side of the A3. And the big picture for this is we have some general comments right in the middle. It's referring people back to the large scale floor plan on the other side. We're explaining the physical distancing circle as a 6-foot radius. We describe the issues with chairs on wheels. And again, we're reminding people that unless it's noted otherwise, we expect that you have face coverings on even when you're indoors. So this is the shared side spaces, and these are the spaces a lot that we talked about previously in the presentation. So we're talking about workstations, which if it's an open workstation, it's shared. If it's an office, it's not. You know, the private and shared office comments are to the left there, and then large and small meeting rooms, break rooms, reception areas, and restrooms. This is intended to be complemented by the signage that we would have around the space. So in our case, we're looking at a very simple 2-page graphic. We're used to reading plans. We're used to reading circles. This was done in a piece of drafting and design software, so it's a little bit more complicated to get the specific 6 foot, and you might not have that available to you, but you can almost always mark up things in PDF if you choose to use the visual. So next slide, if you would, and we're going to go through one last presentation here. So this is a really great plan that Campus Rec came up with, and it had to do with aquatics. Now, the interesting thing with this is of course, specific to this one, this isn't just employees, but this is students and visitors that are going to be using the facilities. So they wanted to take a very different approach. This is a narrative kind of checklist approach. It was very effective for them. This is the first of 2 pages that are out of 10, as you can see. And a couple of items to notice. They detail their building preparations. Okay, some people, particularly guests, and even people, students and faculty staff that use the spaces may want to know this. So it's really good to share. Being transparent with this stuff is important. People are obviously asking a lot of questions, as we can see just on this seminar here. They detail the steps to be taken prior to their eventual opening, which is also good. They're sort of sharing with you, and particularly with outside entities, what they're doing in order to respond to this. They offer detailed cleaning procedures, protocols for cleaning commonly used equipment, who's going to be responsible for the cleaning, and those type of things. Very important for their particular plan. And the key here is to remember the unique needs of your work site. So this is absolutely your work site in your space. So you need to respond to your group of folks and who's going to be using it. Okay, so that's it for these. Thank you.
Thank you to all our speakers, and thank you all for hanging in there with us. I know it's a lot of information, and I will open it up for Q&A in just a moment. We want to remind you of the resources that are available to you that you can refer to, that everything that you saw on this session in this webinar. After the webinar, we will send you links. There will be the PowerPoint presentation will be readily available to you. Also a recording of this, so you guys can listen in again if you need to. So the first place that I would say is your go-to will be the Campus Ready website. It's where the most up-to-date information will be published. Yes, bookmark it, have it as a reference ready to go in case any questions pop up for you. And then of course the template will be made very shortly after the webinar when we do our follow-up email to everybody thanking you for your attendance with all the links. We will also include the template and the checklist as well. The template will contain ways to start your planning, provide you a list of areas that will be addressed, and the checklist will be more comprehensive list of things to consider to help you with your planning process. And then signage. The website will have all the various downloadable signage to put in the various areas that was covered by Jim. And then if you still need support, you still need you have a more specific question, something that wasn't covered here, or if we didn't get a chance to answer that question, please email at campusready@ucdavis.edu. And again, I can't reiterate enough how much most of the information will be available on the campus website. So with that, I'd like to open it up to Q&A. And if speakers, you guys can unmute yourself so that way any one of you guys can jump in and answer one of the questions. Brianda or Henry, do you have one or two to get started?
Sure, there's a lot of good questions. I'm gonna start with some that I think were asked a couple of times in different ways. So Jim, I'm gonna start with you. I think you provided more clarification at the end, but I just wanna make sure everyone's really clear about how do you handle physical distancing with cubicles, including the use of face covering. So does 6 feet apply if in a cubicle setting? And are face coverings required at all times?
Okay, so I'm going to give you my interpretation of this. I've read this thing 100 times, and I go back and forth with it. But here's my take on it. If you are using any one of the methodologies, whether it's a flex time or a flex space, and depending upon how your plan has been put together, I think that you can maintain a greater than 6 foot dimension. Part of the reason that we use the 6 foot radius instead of the 6 foot diameter, which is what I tried to explain before, is we wanted a bit of a measure of safety in our very basic planning tenets for how many people we were going to have in the space. Now, my take on the physical distancing for a workstation is a little bit different than for an enclosed office. So I'll hit the easy one first. The enclosed office, go in there, shut your door if you like. It's probably more consistent and courteous with your teammates if you're going to be on calls anyway to have the door shut. And then you can obviously remove your face covering there. When you're in a workstation, what we've been talking about within DCM is if you're aligned with your team, in our case, the blue team, the purple team, that's shown on the graphic, we think that you can remove your face covering if you're in a workstation. Now, the other thing is anytime you're removing your face covering, it's got to be at the ready. For one, if somebody surprises you and they come up on you, or two, if you need to walk kind of into the public way. So I saw another question here that was sort of an adjunct to this, and it was probably just upvoted here. What if somebody's walking by you in order to get to their workstation? Because workstations by definition are completely surrounded by walkways or corridors in order to get there. So this one, again, is a matter of maybe extensive safety. I would have the face covering at the ready, but if you're working at your workstation, if your office is not very active and you're not getting a lot of people walking past you, I think that it's safe enough to have your face covering removed. Now, this stuff changes all the time. We have expertise with Dr. Paisley. We've got expertise with Eric Cavigny in Safety Services, and we could have some updated interpretation for that occasionally. But that's the way we've been trying to do it at DCM during the time that we've been working, as if nobody's really near you, you can take your face covering off. Sorry for the long response, but trying to give you a lot of options or a lot of data points to respond to.
Okay, Jim, next question for you. We're just going to stick with you for a few minutes. Can you offer recommendations for working with different building occupants, including those possibly not affiliated with UC Davis?
Yeah, I think I saw the question there too. And again, if I'm understanding it correctly, is sometimes we have departments that are not UC Davis, but they're affiliated, they're close, they have a collaborative relationship. My take on that would be, there's nothing better than communicating directly with somebody on that. Say, we're in a space that we're sharing. We're going to be relying on signage. This is how we're going to be handling our employees. We would suggest you all do the same thing. Or specifically, if you come into shared spaces where we are, we just request that you comply with these requirements. Again, to consider something maybe a little bit different. These are narratives and these are plans that UC Davis is coming up with that has guidance that comes out of it from the Yolo County Health Orders. So we are coming up with our interpretations for on-campus efforts here, but we are not in many ways making up a lot of these requirements. So if we're in Yolo County, even if we're in off-site locations where another county is going to have the health mandates here, we really should be complying with those mandates, and it really should be everyone that's complying with them. I'm a personal believer in a little bit extra communication is not a bad thing. So talking to your roommates is a pretty good recommendation.
Okay, and then last question for you, Jim, at least for now. What determines a single occupancy space? So in the research guidance, it discusses 250 square feet, but for the office or administrative work site, what can constitute single occupancy?
Well, the way we've interpreted that on our plan is really a space with a door is a single occupant. So I don't know if we can go back to the plans. I think it's like slide 41 or something like that. But if we can go back to that, I could probably point it out. Yeah, it's slide 41. So when you've got a door, we're using these as single occupancy. I would absolutely be cautious about using square footage. It doesn't really meet all of the other parameters that you're going to be interested in, and the distancing is probably the most important one. But on this plan, most of the rectangular spaces, whether they're blue or purple in color, we are presuming as single occupancy. When we look at the workstations, we are looking at them kind of as a hybrid, where you can have someone in a desk area but our partitions are 54 inches high. So they don't have the closure or the sliding doors or tops that you might see on other workstations available around campus. And, you know, I would say that if you've got a door, you've got different mechanical space into your, or mechanical service into your space, that would be a single space. Other than that, I would say everything is shared spaces and be a little more conservative that way. I definitely would not look at square footage in these for determining what you think is a singular space. I think that would be more challenging for you.
Okay, thanks. Then next, Gabby, I have a question for you. There's been some discussions in the Q&A about touch barriers for handling doorknobs and handles. Can you help, are you the right person to help provide some guidance on that?
I'm not sure what the question is.
Do you have to use a tissue to open a door, or can you use the back of your shirt, or should they be disinfected frequently? What is the best recommendation for that?
Yeah, well, it's a little bit on. I don't think we're to the point of spelling it out, nor will you even find that in industry guidelines as far as telling people how to touch these high touch areas, right? And you'll see it, like, for example, when you just go, when you go fill your car up with gas. I mean, I see people using gloves and a mask, right, to fill their tank. So I have seen people use tissues, and some are just have their face coverings and nothing on their hands. So it is a little bit of a personal preference. I mean, per the industry guidelines, what we're required to do is some level of cleaning. So, personally, for our areas where we know we're touching these high touch areas, kind of back to what Finis has described, the areas that custodial is not going to be attending to, we are regularly cleaning those once a day. And then, then it's also up to the user if they want to do, clean before and after, a high touch area, that's up to them. But right now, literally on all our door handles for the offices that are currently occupied, there is someone that comes through and wipes them down every day. And then after that, it's kind of up to that individual person, how they want to access. So I don't think we're going to ever get to the point of spelling out how someone's going to touch these, and it's not currently in industry guidelines. It's really just make sure you have a minimal level of cleaning. Again, we go back to the awareness, washing your hands, those things. These are all, all these things together in place, keeps us safe, if that makes sense.
Great. One more question for you, Gabby. Who is the best person, or which unit is the best to ask about approved disinfectants that can be used?
I'm probably going to need a little help with that. I think we have on our website, and Brenda, maybe you can help me with that. But, what's currently on the website, I do know that there was a lot of collaboration with EH&S on what's presently up there. I think if it's something really specific, we could probably reach out to EH&S. But, for an example, our supply chain management, there was a product they wanted to purchase, a cleaning product, and there was some questions about it. So they consulted with EH&S before that was added, I think either to Aggie Buy or was purchased in general. So there is, behind the scenes, there has been a lot of collaboration on what you see on Campus Ready and our safety services experts when it comes to the products, the chemicals, etc. But I think if you can't find your answer on Campus Ready, probably to follow what was just described, I would submit that question to Campus Ready, and it would probably be directed to EH&S or Safety Services SME.
Okay, great. And then Finis, a couple of questions for you. First, hopefully this is easy. Do we know if buildings will be more broadly unlocked in the fall?
That's actually not an easy one. I think in coordination with the campus PD, we are working on a strategy for unlocking and unlocking buildings. And again, it's really based on communication that we receive from each individual department and building as far as how often they anticipate occupying their spaces. So that information will allow us to work more closely with PD on how broadly buildings will be open. So hopefully that answers that question.
Okay, and the next question for you, Finis, can you dive a little bit deeper into how building occupants will know when or how frequently the custodial services team will be coming through and cleaning restrooms and common areas? There was a suggestion in the questions about, is there a sheet that could be added to a restroom that someone could write in the time they were there last?
Yeah, so as far as that suggestion goes, that's actually not the best way to ensure that cleaning happens, only because those items can be forged at times and they can end up lost or damaged. So sometimes that can give people a false sense of security. As far as like a standard, what you can expect is common spaces will be cleaned, twice a day. So your entrances, your elevators, your stairwells, those items will be cleaned twice a day. As far as your classroom spaces, those are anticipated to be cleaned 3 times a day, or disinfected, I should say, 3 times a day. And we're hoping to have more guidance as we get closer to opening up the school, as far as like giving folks indications on what they can do. Again, regular communication with our department on your building's occupancy and your building schedule will allow us to provide you with what we can and can't do. Unfortunately, we cannot give everybody across the campus the same amount of service depending on their occupancy. So we really want to try to put people where they're needed. And so that information will allow us to build a strategy around what you depend on using your space for. So hopefully that makes sense.
Okay, and then I'm still trying to read through some of the questions we haven't answered. Jim, I'm going to go back to you because we still seem to have a lot of questions about face coverings and physical distancing of 6 feet. So let me see if I can ask some of these questions. What if here's an example. What if there are 3 people in a 2,000 square foot shop? The question is mainly, does the county require face coverings regardless of physical distance if you don't have a closed door?
Well, if you go back onto our Campus Ready site, I mean, we're kind of addressing some of those elements. So again, I'll share with folks that things are constantly altering in this. We are taking a more appropriate, I would say, a rather strong approach to wearing face coverings. But then once you get in your space, we are trying our best not to distinctly have a difference between those that are in a workstation and those that are in an enclosed office. I think if you took a slightly more conservative approach, you would always have people, if they were in an open workstation, wear the face coverings as well. We have found within our space that and again, maybe going back to your 3 people in 2,000 square feet, if you're not coming across people, we have not found the need to wear the face coverings when you're sitting at your desk. The minute you get up from your desk, no matter who's in the space, we do have face coverings as soon as you leave your space. So trust me, I'm not trying to provide you a gray answer. I'm trying to give you as much data as I can give you in regard to what your specific plan would be. I don't think that the state and county narrative for workspace is so absolutely black and white on whether or not you have to wear a workstation, a face covering at your workstation all the time. There's also air to be considered in these spaces, and we have been able within our space, again, we're in a rented space, we're not in university space, to be able to change our air to 100% outside air, which was recommended. So we took advantage of doing that, and it really aligns with our overall plans. That's really the way we've been doing it.
Okay, one more question for you, Jim. I know I keep saying that. Everyone loves your plans because they're colorful and they're symmetrical. Other than the Word document that's available on the Campus Ready site, are there any other suggestions you have for others utilizing the tools that you have?
Well, the one that we do have, and you just mentioned it, Brianda, which was good. I mean, it's on the Build a Work Site plan under the Office Configuration Guidance, and you can download from Box a Microsoft document that allows you to edit the narrative. It is a slightly different version of what we did in DCM, and what I would share with you on this one, and I know we probably can't get this thing up on screen, but what this one was we were taking images from a bunch of different buildings around campus, and we were just kind of putting colored dots on them in alignment with a legend that's on the drawing for restrooms, for meeting rooms. You could add that directly to what you get on facilities link. And then again, all of the department should and occupant should, and then the second page bullets are all editable for you. What I would hope is that you could use some of the narrative on the workstation comments, for example. And it's true that it does show the DCM plan, but the intent with that tool was that you can just cut and paste it into your, if you choose to do a graphic narrative, like the DCM version, you can cut and paste it. You can even get rid of the plan image if you don't want that. But we would suggest that you use some version of the bullets to share that with your team. Other than that, I mean, it's a little challenge to work within the computer-aided drafting software that we've got. It's a bit more cumbersome. So the reason we put together this Word version was that it was editable, and we pretty much thought everybody could use that without too much of a problem.
Okay, since we still have time, the last, another question, and I don't know who is the best to answer this, maybe Gabby, but it has to do with, is there any guidance for employees using vehicles for business?
Yeah, I mean, currently the recommendation is one person per vehicle. But we know that's not always feasible. So it's a little bit of a common sense approach in terms of, if there's going to be two of you, you can try to create distance by spacing yourselves out in the vehicles, making sure your windows are rolled down to increase ventilation, of course, wearing your mask. You're not going to hang out in your car and chit chat and have lunch. It's really just to get to where you need to go to, and then get out of the vehicle. I believe I'd have to check, but I think Fleet has provided, there's some guidance around the cleaning of the vehicle before and after, and I'm not sure we could ask or we get more information on how that's being approached from Fleet. So units that have department owned or controlled vehicles can also follow that. But in general, for safety services, if we have a department controlled vehicle checked out by an individual, they're responsible to wipe down before and after use. So it's a common sense approach. The recommendation is one person if you can. We get that's not always possible.
Okay, question for Finis. Can you describe plans to install hand sanitization stations?
Yeah, so we have procured about 2,000 hand sanitizer station stands, and we plan on, again, placing them at the most high foot traffic areas across the campus. They also can be made available by request, by reaching out to our custodial email, and we will be starting at entrances just to make sure that the product gets to the most people, and then expanding into common office spaces and classrooms, and elevators, stairwells, things of that nature. So it will certainly be a phased approach. And they may not be readily available everywhere, because again, we're trying to put them where we need them the most. But if you reach out to us, we can certainly make sure we include you into our phased approach.
Okay, Carmen, I think I've gotten through the majority of the questions. I think most of them that I haven't have been answered.
All righty. So we're going to go ahead and end it a little bit early then. If Henry, do you see anything else? And Brian, you're saying that we're good to go. Thank you so much, everybody. And we will post this for you guys to review. And we're going to post the copy of the slides. Again, all the links will be on the follow-up email. All the links that you saw on the slides will be readily available to you. I saw that Brianda added the office configuration tool from Jim. More to come your way. Thank you again for all our speakers for the questions that they tackled right now at the end. Just as Gabriella said, we are a work in progress and we're getting there together as a team. Appreciate all of you guys understanding, and everybody else, thank you and have a good afternoon.